I'm very delighted today to be able to welcome Dr. Erin Dufault-Hunter as a guest on Conversing. She is not only a person who's had a very, very significant history before she came to Fuller as a highly touted teacher and professor at the University of Southern California, but she has brought the same kind of impact to students who have been influenced by her in the 15 years that she's been on our faculty. Her role is as Associate Professor of Christian Ethics, and she largely works in the area of what it means to be faithful as embodied Christians, embodied people in the world. Erin, thank you for joining this conversation.
Yeah, thrilled, Mark. Thanks for having me.
Well, this conversation is really pretty targeted because today, as we're recording this, it is the 1-year anniversary of the World Health Organization's declaration that the world had entered into a pandemic with COVID-19. And today's conversation is really going to be specific about that year, and then even more particularly about the moment that we're in the vaccination rollout process, not only in the United States, but also globally as well. So thank you for engaging this. Let's start, though, a little bit at the beginning about how you even came to Fuller, because it is actually very related to the kinds of things that we're talking about today. Tell us that story. You were at USC.
Yeah,
and
so
happened.
I was at USC, and I was taking a course in bioethics from someone who actually had an MDiv and a PhD, but hadn't really left the faith. And we were talking about all these things in this course, and I thought we were talking about life, talking about death, talking about how do we understand ourselves to be limited in terms of our embodiment? How do we engage in medicine? How do we engage in technology in medicine? And I thought, why did we not talk about this at seminary? I mean, not to put too fine a point on it, but we're all going to die. That's a guarantee. And a lot of us are going to have children. A lot of us, if not all of us, are going to get sick. We're going to become disabled. We've got to be thinking about this as Christians and Christianly and engaged in these topics before the crisis occurs. That was one of the things that really struck me. And so actually the first course that I taught at Fuller was a bioethics class as an adjunct. Glenn Stassen graciously heard me out when I came back and said, we need to offer a class like this. You need to offer this at Fuller. And I hadn't finished my PhD then, but he was gracious enough to give me a chance as an adjunct to teach the class. And since then, for over 15 years, I've been teaching bioethics on and off at Fuller, which has been
so
great.
Yeah, so incredibly important. One of the words that I would say most marks your vocabulary is embodiment. And since undoubtedly it's already come up and it will come up probably 25 more times before the conversation's over, I wonder if you could just define that word so that any listeners who are less familiar with it would feel at home.
Yeah. So one way of thinking about it is that as Christians, we believe two texts I would talk about this. One is Genesis, that God actually breathes into Adam and he becomes a living nephesh, right? This living creature. And it's the breath of God and the material existence, right? This creatureliness, the very dust of the earth, right? We're now in Lent, right? You are dust and to dust you shall return. But there's this spirit of God that's given to us. And if we speed forward and we look at the incarnation and we think of the wonder that God takes on human flesh. So he both, in some sense, right, honors that we are these creatures, submits himself to all the things that humans, by virtue of our limitations as bodies, he goes through all of that, including death, including a horrific death in his case. And that's a way of remembering that it is possible to be human, it is possible to be fully human and embrace this vulnerability, this sense of the giftedness of our lives as creatures who have this body. And of course, if you look at the end of the story, that we're also mysteriously raised as bodies. We're not these spirits that float around. I mean, that was much more of a sort of Greek idea of immortal souls, right? Jesus is risen with a body that is wounded, which is a whole other fascinating piece, right? A body still with wounds, with a memory of his embodied life and yet transformed, right? And so that for me, it's that embrace of this gift of God's breath, this wonder of the Spirit who fills us, who gives us this body as both a limit and a wonder. And that intersection is something that's fascinating to me.
Right. Right. It is.
Yeah.
It's at the very core of trying to sort out everything about our existence, the nature of the world around us, our relationships with each other, our relationships with creation, etc.
Yeah.
So you're the perfect person then to have this conversation with today about something as material, as embodied as a pandemic, which ends up exposing to us in this brutal, brutal, brutal way over the course of this year how finite we are, how limited our resources can often be, how difficult and challenging science is, how reliant we are on technology and accessibility to any of these resources. So as you remember where you were a year ago today when you heard about the World Health Organization's declaration that the world was now in a pandemic, what do you remember about your hearing that, and how did it strike you?
Well, I have to admit that I didn't, maybe I was one of the only ones. I remember leaving a faculty meeting when we decided not to meet in person anymore. And I remember thinking, this is really an overreaction. And within a couple of weeks thinking, wow, I was really arrogant. I wonder if that's partly by virtue of being a Westerner who has lots of access to medicine. I've never been through a pandemic before. My students did not take, especially my students who are from Asia, especially those who were from Hong Kong and China. They had actually been wearing masks in my class for months. And they were much more humble and much more aware of how fragile we are. And how they were actually very conscious of not exposing other students because they recognized that they engaged in a community that had already been exposed to this pandemic, and they were extremely cautious. So actually, I look back kind of embarrassed, actually, and thinking I somehow thought that by virtue of maybe my class, my racial background, my place, that wasn't going to happen here. And my students were right, and I was not.
Right. Yeah. I remember being struck myself by the wonder of it, like literally not having been through a pandemic, of course, either, thinking, I don't know what that even really means exactly. I know what the words mean, but I don't know how such a thing actually unfurls. And is it about just kind of general hygiene, or is it about something really quite specific? How pervasive, how intrusive, how reordering it is. And it did occur to me not long after the declaration was made that Fuller must and would absolutely abide by a full response to go virtual and to remain such until we believed the right time was at hand to actually lift it. Though, of course, it would have been totally unimaginable at the time that anyone would have thought it was going to be more than a year, which it will have been by the time.
Yeah.
So, it's just amazing.
Yeah. I'll throw out to you one more thing that did occur to me. I think it was a couple months after the pandemic, and I was realizing how arrogant I had been because, like everyone, right, it was like my life, everybody's life completely shifted aside. And in our case, I knew a good friend of mine actually lost a family member very quickly, not someone they were expecting to lose. And so it was, for me, that was quite shocking. We weren't distanced and protected, so to speak. And I wrote this very short essay for a friend of mine's birthday, something like on microorganisms and mustard seeds. And I recognized that how my life had shifted, how all of our lives had shifted around this minuscule, the power of this virus that's minuscule, and how little I believe Jesus' words about if you have the faith of the size of a mustard seed. I said, boy, I'm really bowing at the altar of the microorganism right now, right? what would it mean if I were willing to let the mustard seed of faith reorganize, or if we were willing as the church to let that mustard seed of faith reorganize our lives as much as this viral infection has done?
Right. So let's look back then over this year. And I'd love to hear your reflections as you've watched and experienced from your own particular point of view, the way in which the medical and political problems and challenges of the virus and the issues of prevention and so forth have unfolded. Also, the way that care has been so unevenly distributed, the populations that have been particularly poorly served by a fundamentally unjust healthcare system, et cetera. Just what's the sweep of the things that you've observed and found yourself most reflecting on?
Yeah. Boy, there's no shortage. In some ways, I think that there's a real congruence of things that many of us are realizing over this last year. I think that the efforts to highlight racial inequity and the systemic ways that inequities are not so much individuals who don't like people of a different color, but how that has just seeped into systems like delivery systems for healthcare,
right?
How that access works out. A much longer history as many of, I'm sure a lot of listeners know, there's a long history in the United States of distrust of the healthcare system from racial and ethnic minorities. And that's not unfounded. There are reasons for that are both go back to things like the Tuskegee experiments, which were experiments on Black men who had syphilis, and they were not actually, even when penicillin was available, they were actually not treated because they wanted to study the way the disease worked out in these men. To today, we're seeing some of the fruit of ways that, for example, ways that women, this is one way that this comes to the fore, is ways that women don't want to go to hospitals to have their children if they're Black or brown, because, and this is research actually bears this out, that many of them are not listened to. Pain is not counted as seriously among Black and brown people. And there are reasons that there's this reticence to trust the healthcare system on one end, and clearly a failure of the healthcare system to be accessible, to deliver healthcare to, for example, right near me in Willowbrook, Martin Luther King Jr. Hospital was one of the hardest hit, high mortality rates, all Black and brown, almost all Black and brown folks who are in poverty or lower middle class. And the numbers are astonishingly higher in terms of morbidity there around COVID. So there's all these things that this year, I think, has helped expose in very concrete ways, things that I think used to be sort of ethereal for people, right? Like systemic racism, like what does that really mean? And we're like, oh, well, okay, let's look at the pandemic and let's look at who's being hardest hit. Why is that? Let's really dig into why those things are true. It's not because one or two people are prejudiced against someone. It's that this is just infected virus, right? That the infection of racism has so steeped to us that we're seeing how that's really coming to the fore in the midst of the pandemic. I think in some ways, for lack of a better term, it's helpful. It's really concretized that for us.
Right.
And asked, how do you address that?
Right. And then you add to it a political landscape of the last year, which is deeply complicated, all of this. And the various demonstrations in response to George Floyd's death and the death of many others as well, that is really a story which adds on yet another layer. And it has been really painful to watch, really, really painful. On the other hand, the interesting thing has been that the pressure of this crisis has caused medical breakthroughs of a kind that would have taken much, much longer. Having lived in the pandemic, as it were, of AIDS in San Francisco as it was unfolding in the 80s, and being aware that even today there isn't, quote, a vaccine for AIDS. And so all of these lives all around the world that have been lost as a result of this is a scale of a kind of medical challenge that, despite incredible resources, has not actually conquered that particular disease. Now we're facing a completely different and genuine pandemic of a broad cultural kind. And the medicine has been spectacular in most cases. And the success rate of these vaccines is so much higher than they would have even hoped to get. And the breakthrough in RNA research that has created a pathway for other kinds of treatments in the future to develop around other kinds of viral incidences that no doubt will unfold is really just so amazing. But the thing that I want us to talk about then is really this current moment of the crisis, really around vaccinations themselves. They've been developed, they've been appropriately tested, and yet the legacy issues that you're describing, the political and the economic and the racial dividing lines, and the fearfulness that exists, therefore, in so many different pockets of hesitancy and or outright rejection of the vaccinations is potentially creating a great threat. So I'd like us to zero in on that and how you've reflected on that ethically and what you believe are some of the most important next steps that we need to all be aware of and help others to consider.
Yeah, so let me start with a kind of umbrella reminder to us that I think that actually, and this may be particularly Christians like us in the West, we think about even things like healthcare as a kind of individual good. So people are even thinking about the vaccine as an individual good. So for example, some of us are really distressed. Actually, many of us are distressed for the very reasons you identified, that I'm getting the vaccine before people who are delivering my food, right? That's just wrong, right? I mean, they're clearly at more risk than I am. And we wish, and I wish, that there were a way we could rearrange this so that I could actually give my vaccine to someone else, right? And one of the things that I think helps us in terms of bioethics and thinking about medical care and healthcare in general, that isn't maybe very popular among conservative Christians in particular, is that it actually isn't an individual thing. Healthcare, and I think we sense this more in the pandemic than we ever have, is we are so interconnected. Germs and viruses don't care what my background is, how much money I make, whether I have papers or not to be in the country or out of the country. It doesn't matter. And in things like viruses, it's going to spread. And it's going to go from person to person. And the more people, the quicker we can get everyone vaccinated, the safer everyone is, including that person who's delivering the food to my door. And it's all of us kind of coming together and working together, this so-called herd immunity, but also just on this basis of when we can get access to the vaccine, take it. Not so much because I want to be selfish and for good reasons. Some very good Christians are saying, I don't want to take it for that reason. And I want to say, I get that. Unfortunately, it doesn't really work that way. We're not going to solve yet. We're going to keep working on it, but we're not going to solve the problem that the delivery system is not efficient and is biased, is not working effectively for people it needs to. That's a problem. We're going to work on that. But one way you can concretely help folks who are at risk, who are people in the service industry, people who are essential workers, teachers, is for you to get vaccinated, because that actually affects everybody. So the ways that we conceive of healthcare in this country are often like, well, I should be able to, I sort of individually buy my product, right? And this pandemic, I think, is reminding us that's not actually how healthcare works. Healthcare really is a common, shared, mutually interdependent good. so that when some people get terribly sick, it actually doesn't generally stay with those people. They may pay a higher price, but it's going to spread. And we know that to be the case. And I think we can see vaccines as one way we can participate in that common good and the care of neighbor in very specific terms. And that is a love of neighbor, not a disregard of neighbor, not a competitiveness for the vaccine, but an acknowledgement of that interdependence,
right,
of care. And it's a very explicit way of caring for people who are most at risk of this, of being hardest hit and most affected by this pandemic.
So I'm aware that you're a Christian ethicist, that you're not a medical planner.
Yeah.
So I'm not suggesting that this question is being addressed to somebody who is a system planner for a national medical crisis. But if you were imaginably the ethicist for the healthcare system of America right now, and you were addressing it through the lens of the vaccine, what would be maybe the top 2 or 3 things that you think are the areas where further reflection and change is most needed ethically? What would those things be?
Well, around the pandemic in particular, and getting vaccines to people that really need it.
Right.
That challenge, I've been sort of listening in on some conversations about that. Because, say, in LA, where we live, LA County, that actually has not been very successful. We have really been failing to get poorer folks who are the kind of essential workers who are doing service and industry. They're not actually accessing those vaccines. So part of that is like simple things like transportation. Another is language barriers. Another is trust. So LA is actually now trying to switch. They set aside the vaccines. They thought they were being really efficient. They put out, notices, but people didn't come. Not enough people came from those populations. So now they're rethinking it. And I think this is smart. They're saying, okay, we need to actually go to parks. We need to go into neighborhoods. We need to be talking with people, building trust with these people, and going where they are. So they're not having to take 8 buses to get to, I went out to Woodland Hills. Well, how would they get to Woodland Hills? If they have a job they have to be at, and the bus ride out to Woodland Hills is how many hours? How are they going to fit that in? These are really practical obstacles.
Right.
And so being creative and reimagining, like even how you deliver more mobile, and I would say much more community. One problem we have had is we're not very community focused. We're not very open to communities telling us how they need healthcare delivered to them. Trusting and empowering leaders who are actually in those neighborhoods, who may not be the healthcare professionals themselves, but they know how to get that to the healthcare professionals. So that's one thing that I think in terms of the creativity that's breaking open a bit, and
right.
And healthcare folks are recognizing that. Do I get to be queen of healthcare?
Yes,
That'd be so awesome.
Yes.
I'm not ashamed to say that I am a universal healthcare person. The irony. So let me talk about something that's called what is it? I forget the term right now. But there's a kind of opposite intuition about how vaccines actually should work, and it's this: if you were just going by the most effective way to curb a pandemic, you would actually vaccinate the people who are out and about and low risk. And the reason for that is that they actually get infected at a higher rate, and high risk people actually get infected at a much lower rate, partly because they're more cautious. But if you think about people who are in care homes, who are at high risk and have paid a tremendous toll, what would have made sense is to actually vaccinate people who don't think they need it, right? Again, this is the way that we don't comprehend that there's an interconnection, that even if I'm presenting as healthy, I may be placing my neighbor who's at risk, but I'm asymptomatic. I don't know. I don't think I need the vaccine. I don't need to be cautious. And maybe I don't for me, but I'm actually the person who absolutely should get the vaccine first because I'm the most likely person to spread it to everybody else. Of course, that's not politically correct, and there's lots of reasons why people object to that. But the difficulty there, of course, is that we don't have a mindset that's actually willing to acknowledge our vulnerabilities to each other and our need to actually take care of and our responsibility for our neighbor. We tend to think of healthcare as something that I purchase, I get. And there are so many ways that has really, to my mind, warped the way that the United States has planned or not planned a very effective healthcare network, so that we have a kind of odd mixture of private and public that, it isn't working as well as it could. I'm glad that we have some kind of universal healthcare. I'm very grateful for that. If you don't know, the leading cause of bankruptcy in the United States for individuals and families is healthcare, because people come to this. And if you've ever gotten a bill from a hospital and you've looked at what the insurance pays and then the insurance discount, and then you look at what you pay, and imagine you're not paying the insurance discount, which is pretty darn high, thousands of dollars, potentially even simple surgeries. But imagine that you have a healthcare crisis for your child. Of course, you are going to do everything you can, but people go into massive debt because they simply cannot pay these bills. Right. I think Christians should be up in arms about that kind of thing, because we should think no one should have to choose between bankruptcy and getting healthcare for their kid. That's unconscionable in a country, especially like ours, where we do have the capacity and the creativity and the infrastructure to deliver quality healthcare to people. I figure if we can, land a rover on Mars in the way we did just so excitingly recently, that we can figure out a way that we get a minimal amount of healthcare for everybody.
Yes.
And if we'd had some of those things in place and we'd developed some of that trust and those delivery systems, we wouldn't be seeing, I think, the numbers that we're seeing now, and we wouldn't see so clearly how systemic racism and poverty and classism really has shattered our neighborly bonds.
So profound, Erin, really. It's an incredibly important set of issues, and it is a cluster bomb, right? It's a series of things that explode together, and they explode together because they're already enmeshed. And with the right detonation, it sets off the calamity that affects in every direction devastatingly. In the few minutes we have left, I want to zero in on pragmatic steps. I think that the concern is that at this moment, where we know that there are still vast proportions of the American population that seems to be resistant either to getting it or are indeterminate about whether they're ready to get it. And then there's people who are also just among unreached people who just haven't yet been drawn in. But if they had the right reassurances, they would be ready to be vaccinated. I just want to be sure that I've had a chance for you to share with listeners anything you want to say about those pragmatic steps and ways that people that might be listening could encourage higher and higher vaccination rates among any of the places that they live.
Well, boy, where to start? So one thing I just want to encourage people to do who choose to be vaccinated is, where you can, begin to address the difficulties that others are having during this pandemic who are not vaccinated. Once we're vaccinated and we've waited that period of kind of getting fully safer, and it's relative, right? We're humans, it's safer. What we need to think about is, how can we then begin to visit people who have been shut in? There are so many people languishing right now. moms with young kids. I was talking to a mom yesterday who just broke down. She's got a job and she's got 2 young kids at home. And she said, I just don't know how long I can keep doing this. There's no relief, right? Well, if we're vaccinated, we can actually begin to do some of that relief. We can begin to take kids. We can begin to visit people. We can begin to deliver food. We can go to healthcare homes. We can also start to pick up some of our neighbors and transport them safely to vaccinations, to job interviews, to concretely helping them navigate how they are going to get out of what has for many people been an economic and personal, emotional, psychologically devastating time. So I want to encourage people to think about intentionally using your vaccination. If you choose to be vaccinated, use it in some way to enact your neighborliness for those who are not, who are at risk, who can't access. Think creatively about what you now are able to do, yes, and take that as a gift that you've been entrusted with, because right, it is a gift. And how do we then move into that and receive it as a gift from God? And we're responsible for the gifts we've been given, mm-hmm, right?
Right.
Another piece is I would really encourage those who are questioning the vaccine. You sent some really lovely stuff from Curtis Chang. There's a lot of helpful material out there helping people understand. I am thrilled that some Christians are thinking Christianly about the vaccine, right? They want to be faithful, and I want to affirm that. That is my passion in teaching bioethics. Don't just take what everybody says. Think Christianly. Think as someone who has this alternative story. And for those who are questioning whether or not they take the vaccine, I do want to push them to say, I think we need to do that responsibly by doing due diligence of moral discernment, as the church calls it, right? The reason we have the Spirit is because we are facing times and decisions. If it were rules and all just rules, we just need to figure out which rules, or even we just have these rules and we apply them, that'd be great. But life shifts, context shift. We have faced new challenges as Christians, but we're not left alone in that. We have the Spirit. Many of us have intelligence and ability to think through these things and access things like Francis Collins and his articulation of what the vaccines are actually doing as someone who's a Christian and a lead scientist in the country. Listen to these people, take that in, and begin to, I would also encourage my friends, I would say it's difficult for those who are reticent to take vaccines and those who are adamant about taking vaccines to talk to each other. And one hope I would have, among Christians at least, is that we would have the curiosity to listen to each other, and not be afraid of what the other person's going to say, and not say, I have to persuade you, but can we talk about this? And can we read each other's stuff? Somehow, when you alluded early on, Mark, to the great divisiveness that's really marking certainly our culture and society at this point in time, and the church, we have a tendency more to write one another off. And I am convinced in all my reading, and I've gone to people that I trust, resources I trust, and I'm convinced that the vaccine is a faithful thing for Christians to do. And it has all kinds of repercussions for neighborliness. But I also want to take seriously my friends. I have some dear friends who are very reticent to take it. And I want to not shame them. I don't want to cut them out. And I want to listen. I want to listen to what they're saying and not degrade them, but recognize, yeah, we have a deep difference. We have a pretty significant difference around something that matters to you and I very deeply. And how can we bear with one another in the midst of that? I would want to also remind people that medicine is a practice in a couple different ways. How do I put this? I want people to receive the vaccine and enter into this vaccine discussion, recognizing that we're engaging in something, again, as fragile creatures, right?
Right.
That scientists aren't saviors. I have a savior. They're not my savior. I also believe in a God who's given the gift of technology, of the arts, all kinds of arts, including the healing arts. And we need to hold those things in tension, that medicine is a practice, meaning it's an art, but it's also something that there's always unknowns. There are risks. And I think we need to be open about that as Christians and say, there is no risk-free living. We participate in medicine. We're all participating as those who are willing to be vaccinated, like you and me, I think. We're participating in medicine and in discovery right now.
Right.
We always are, but we're very aware we're doing it right now.
Right.
And that's both exciting and a little scary, right?
Sure.
And I want us as Christians to say, but we can take that up not as fearful people and as people who then are going to get angry if something goes amiss in this, but take it up and say, what's the faithful response? We've recognized our finitude. We did the very best we can. I mean, these vaccines look amazing. I mean, the rates of efficacy are really quite astonishing. So there's all kinds of reasons to be very hopeful. And I'm going to cheer people on to take the vaccine. But I don't want people to be falsely, I think the good that the pandemic has reminded us about are these two things, right? This interconnectedness to one another, a mutual responsibility for each other. Whether I vaccinate or not should not just be about me, right? It's
right.
about how I understand myself to be part of a common shared good. That I'm called as a Christian to encourage, perpetuate, and pursue as a witness to God's goodness in the world and God's care and love of the world.
Amen.
So I'm sure that we can actually, and you will after this podcast, we can link different resources for people, some more sciencey ones. The other piece that I just want to throw out is for people to be conscious that some of the folks who have a reticence about some of these vaccines, particularly the Johnson & Johnson vaccine that's coming up, there's some reasons that people are, we don't necessarily need to go into, I don't think we have time, about why some people are reticent as Christians to pursue them because of some things related to fetal tissues and stem lines. And the thing that I want to remind people about is that those who are the J&J vaccine, the exciting part of that is that poorer countries who cannot afford and do not have delivery infrastructure to refrigerate, that the J&J vaccine is their hope. And for us to kind of morally stand back and say, oh, could you please pay the price? I had the morally less compromised vaccine. Could you pay the price of someone who's poor in a different country, in a neighborhood where, you're being devastated by this disease? That's a moral problem. That's mistaking a kind of moral purity that has little to nothing to do, I think, with the kind of purity of heart that Jesus is talking about. Moral purity actually connects us to each other, I would argue, in the scripture, purity of heart. Whereas that kind of purity makes me stand off from someone and say, I'm not you, and I'm not going to get involved with you. So my hope is that these vaccines will help us lean into each other, lean into our call to love people concretely, to be like the Good Samaritan, right? What does it mean to, now that we're vaccinated, put someone on our horse, get our hands dirty? Because we can do that now. And we can do that in ways that don't endanger other people.
I think you've done a magnificent job. Thank you today very much, Erin, for everything you've just shared, because I think it tees up the larger landscape morally, theologically, spiritually, culturally, as well as medically. And I think this is just the conversation that I was hoping we could have. And I really, really appreciate what you've contributed. On behalf of everyone, I just want to say thank you. Thank you for being part of Fuller. Thank you for being on our faculty and doing such a great job. And thank you specifically today for the way that this
So fun.
gives us an opportunity.
Such important stuff.
It's so important. Thanks, Erin.